Ladies and gentlemen, thank you for standing by, and welcome to the North Coast Coronavirus Town Hall. At this time, all lines are in a listen-only mode, and as a reminder, today's call is being recorded. I would now like to turn the conference over to our host, Senator Mike McGuire. Please go ahead, sir.
Good evening, Kerry. Thank you so much. We appreciate all your help tonight. First and foremost, I want to say a hearty welcome and thank you all for joining us for our North Coast Town Hall focused on our coronavirus response here in the Golden State. The most important part of tonight is hearing from each and every one of you. We're going to spend as much time possible answering your questions in real time. If you have a question or a comment, please hit us up now, senator.mcguire@senate.ca.gov. We're looking for your questions now, senator.mcguire@senate.ca.gov. Again, my name is Mike McGuire, and I'm honored to be able to work with you each and every day as North Coast State Senator, representing both Trinity, Del Norte, and Humboldt counties. We have an incredible panel joining us tonight. But before we get into tonight's town hall, I want to be able to provide some very brief opening remarks. Being honest with you, the last 2 weeks have been some of the most surreal and challenging in our lifetime. And I know we have some of the toughest days still ahead, with the anticipated peak of the coronavirus not expected to hit at a minimum of 4 weeks from now here in the state of California. Here's what I know that will get us through to the other side. We're rural. We're rural California. And in rural California, working together isn't just a nice thing to do. It's a necessity. It's a necessity for all of us here on the North Coast, and it's part of who we are. It's in our DNA. We pull together like nowhere else in this state when times are tough. We get things done no matter how hard times are. And today, and this issue is no different. We're all working overtime to make sure Del Norte, Trinity, and Humboldt counties have the resources we all need to respond to this virus. I'm so proud of the work that you've done and that we've done together over the last 5 years. And please know that we're here for you now and in the months and years to come. I would now like to be able to introduce our speakers and go through the flow for this evening's town hall. First and foremost, I'm going to provide a very brief update on coronavirus response efforts from the state of California. We're then going to turn the floor over to Dr. Art Reingold. He's the head of Infectious Disease School at UC School of Public Health. He's going to give us an overview of the virus, briefly describe what it is, focus on the shortage of tests, should we or should we not be wearing masks, and on the best way that we can control the virus, and do shelter-in-place orders actually work. We're then going to turn it over to Dr. Teresa Frankovich. She's the Public Health Officer for Humboldt County. We'll then hear from the Public Health Nursing Director from Trinity County, Marcy Joel Cutzel. We're honored that the Chief County Administrative Officer from Trinity County, Richard Coons, is with us as well. Then we're going to move north to Del Norte County to hear from the County Chief Administrative Officer, Jave Serena, and Public Health Officer, Dr. Warren Reynolds. I'd like to be able to transition now to the state of California and where we're at with this point. And as you know, we've had to take some dramatic action across this state to lower the cases of infections of coronavirus. We remain in constant contact with hospital and health center CEOs across the North Coast and in the 3 counties. Our number one goal is to ensure the needs are being met with protective equipment and medical supplies. The California Office of Emergency Services started last week and will continue in the weeks and months to come, delivering mutual aid for personal protective gear and other medical equipment. And again, we're going to continue this mutual aid in the weeks and months to come. We're in constant contact with the Humboldt County, Del Norte County, and Trinity County Office of Emergency Services. We believe, at a minimum, the state will be under a shelter-at-home order through May 1st. The bottom line is this. The virus continues to spread, and hospitalizations are continuing to increase. At this point, the majority of hospitalizations are south of us, not necessarily on the North Coast, but we are seeing an uptick in cases, especially in Humboldt County. Statewide, we've quadrupled the number of residents in ICUs over the last 6 days. Hospitalizations have tripled in that same 6-day period. We're approaching approximately 9,000 confirmed cases across the Golden State. Our top priority remains this. We need to make sure that rural California has the resources needed to combat this virus. This is truly a historic all-hands-on-deck effort. We know challenging days are in front of us, but this state is coming together like never before. The legislature recently passed a $1.1 billion spending bill that will expand hospital capacity across California. We're going to be erecting 8 field hospitals. Those are already in development. We're opening up 3 formerly shuttered hospitals. And the USNS Mercy arrived in the port of Los Angeles, providing this state with 1,000 beds on the Navy's hospital ship. And that ship couldn't come at a better point. Currently, California has 74,000 total hospital beds in over 400 hospitals. We believe we need to expand our surge capacity of hospital beds by another 50,000. Here's how this is going to work. We're asking the over 400 hospitals to expand their capacity by 30,000 beds. The state will be responsible for developing the remainder of the 20,000. And we're working 24/7 to make this goal a reality. Now, there is some glimmer of hope. Thanks to your hard work, and candidly, thanks for your sacrifice, we have seen some slowing of a surge in local Northern California hospitals. The aggressive stay-at-home orders are starting to work. Are we out of the woods? Not at all. We have a long way to go with this fight. But if we did not move forward with these aggressive stay-at-home orders, we now anticipate we would have needed 700,000 hospital beds, when now we only need 120,000. That's no small feat, but again, there's a lot of work in front of us. Finally, there has been a significant focus at the state level on elementary, middle, and high school education related to this virus. And based on current modeling, we want to make sure that folks know parents should be prepared to not bring children back into the classroom this year. That said, distance learning is going to continue with each school district on the North Coast. I'll be the first to say, and my wife is an elementary school principal, seeing this firsthand. This has been extremely difficult for students, and it's been especially difficult for parents who are at home with their kids, trying to make ends meet. But social isolation is the best tool we have to be able to beat back this virus. Tonight, we're going to give you all the tools you'll need to be able to combat this virus. How to be able to access the best health care, how to be able to enroll on unemployment, and if you're a small business owner, how to access capital to keep your business moving forward. But without further ado, we now would like to be able to turn it over to the overview of the coronavirus with Dr. Reingold from the University of California, Berkeley School of Public Health. Dr. Reingold will have 5 minutes. Dr. Reingold, we welcome you to this North Coast Town Hall. I'll give you a 30-second prompt as you approach the 5-minute mark. Thank you for your time, sir, and for your incredible work.
Well, thank you, Senator McGuire. I hope everyone can hear me okay. Thank you for the invitation to help with this important town hall. And I hope I won't need the indication of the 5-minute warning. I'll try and be brief, just to set the stage a little bit for people to talk about the local situation and then leave lots of time for questions. So let me begin by saying that we live in an electronic age. And so all of you have access to lots of good information. In fact, the same access that I have in many cases. So I run the risk of boring you with information you already have. But I would encourage you, if you want to follow the types of information I'll be talking about, to go to the websites of the World Health Organization, the U.S. Centers for Disease Control and Prevention. And frankly, the website I find most useful is that put by the New York Times, which is updated multiple times a day. So let me just quickly bring you up to date. It's quite remarkable that it's really only been a little over 3 months since this virus emerged on the world stage. And there's no question that every day brings new revelations, new information, and an evolution in our thinking. And I hope people don't find that too confusing. So as best we understand it, the cause of this illness, the coronavirus called COVID, that caused the disease COVID-19, probably made the jump from an animal to a person in and around Wuhan, China, probably at the end of November of 2019. All the molecular studies would suggest this was a single event that resulted in the virus moving probably from a bat into a person, maybe through an intermediate animal. But unfortunately, once the virus made it into people, it proved to be readily transmissible from one person to another. And the result has been, first, a very, very large dramatic outbreak in China, in the area of Wuhan, and then, unfortunately, dissemination to the rest of the world. And so we find ourselves today with quite a remarkable set of circumstances as a result of that virus, in part coming from an animal, getting into people, but then in part because none of us in the human population is immune to this virus. And this virus turns out to be quite transmissible, easily spread from one person to another. So as a result of that, as many of you already know, the outbreak in China involved about a little over 80,000 people and about 3,300 deaths, and was apparently brought under good control through what I think many of us would consider quite draconian and strict measures, which I'd be happy to talk about. But nevertheless, despite the ability to control it in China, the virus had already spread to a number of other countries, causing outbreaks in South Korea, in Singapore, and a number of other countries in the Asian region, but then also making it basically in the noses and throats of people to the rest of the world. The result is that as of today, we have an estimated or counted number of a little over 918,000 confirmed cases and over 46,000 deaths from this viral infection. But we all recognize that number of cases is partly an artifact of not testing people everywhere. So the number of infections is clearly much greater than that 900,000. At the moment, the countries with really severe outbreaks, as you've seen on the news, include Italy and Spain, followed by Germany and France, Iran, and the United Kingdom. But unfortunately, this is an area where the United States has taken the lead globally. As of today, my numbers tell me that we've gone from 70 confirmed cases a month ago, 70, to over 210,000 cases in the United States confirmed as of today, and over 4,700 deaths. If you're watching the news, you'll know that we have a huge problem in New York City and the surrounding areas, over 84,000 cases and almost 2,000 deaths in New York, and then large numbers in New Jersey. As the senator already said, we've got about 10,000 confirmed cases in California and a little over 200 deaths as of today. But we have burgeoning outbreaks in Michigan, in Massachusetts, in Florida, in Louisiana. Admittedly, most of these outbreaks are currently largely in urban areas, but we clearly have spread of the infection to rural areas, and we have infection in all 50 states. And at least 4 of the territories of the United States. So in response to this problem, and in the absence of a vaccine, which we know we will not have for at least another year, if then, we clearly have been trying to deal with this outbreak in the United States. One of the things you'll be aware of is that while we're one country, we're 50 states and some territories, and much of the law around control and prevention of infectious diseases actually is in the hands of governors. So some states like California have been very proactive and are very expeditiously moved to prevention and control measures. Others are just getting there literally as we speak. So Florida has announced that starting tomorrow night at midnight, it will put into place mandatory social distancing maneuvers. So we have a very a disparate set of circumstances in the different states. And even within the large state of California, of course, we have quite different situations at the moment in various urban areas and in various rural areas. So that's just a brief summary of where we are. I've been asked to make mention of several things. First is obviously the issue of social distancing and the fact that Governor Newsom, at a statewide level, but before that, various counties, particularly some in the Bay Area like San Francisco and Santa Clara, have moved aggressively to strong social distancing maneuvers that are intended to reduce our opportunity to infect one another and to reduce person-to-person transmission in settings as diverse as grocery stores, schools, and workplaces. There's some very preliminary evidence that those measures are already flattening the curve, if you will, in counties that initiated this quite early. And as the senator said, we are hopeful that within the next 2 to 3 weeks, we will see evidence of a similar flattening throughout the state of California, but it's a little too early to know exactly what's going to happen.
Doctor, we have about 30 seconds.
Okay, sorry. So I've been asked to speak briefly about masks and testing. The availability of testing is ramping up quickly, and that's a good thing. We need testing to help us in our public health measures. You'll be aware that just in the last day or two, there's a suggestion that masks may be a good thing to do globally, and we can talk about that in the question and answer period. But one of our counties in the South summed it all up this way in 3 short sentences: stay in your place, maintain your space, and cover your face. And so that's a lot of information in 3 very, very short sentences, and I think that's very good advice.
Doctor, thank you so much. Dr. Reingold from UC Berkeley School of Public Health. We're going to be getting back to the doctor with questions. If you have questions, we're getting literally dozens coming in. senator.mcguire@senate.ca.gov. Your questions, your comments, we're going to be going live in real time in just a few moments. But before we do, we'd like to be able to turn it over to our public health experts. We're going to start with Dr. Teresa Frankovich. She is the public health officer for Humboldt County. We want to say thank you to the doctor for her incredible work over these past 2 weeks. These 2 weeks seem like months. And we're going to turn the floor over to you, Doctor. You have 5 minutes. I'll give you a 30-second prompt. And we welcome you tonight to the town hall.
Thank you so much, Senator. Here in Humboldt, the community of public health, our agency partners, and the public are really working hard to slow transmission of COVID-19 so that our healthcare system will be best able to accommodate need as case numbers increase. We recognize it as a sacrifice for everyone, and we honor that sacrifice by complying and maximizing the impact of the shelter in place. In our county, nearly 750 individuals have been tested to date. Our testing rate per capita has consistently been higher than national and state rates, and I credit this to our small but excellent local public health lab as well as our community providers who have worked very hard to get people tested in collaboration with us. Today, Humboldt County reported 28 total cases of COVID-19. 8 of these cases were in travelers, and 13 had contact with a known case. Many of these contacts were travelers. We also know that we now have 3 cases classified as community transmission, meaning that they do not have a known contact or a history of travel. On April 19th, we issued a shelter-in-place order here in Humboldt County, and later that evening, Governor Newsom did the same. We are all working very hard on case identification, investigation, and issuing orders for isolation and quarantine as another way to help slow transmission within the community. At the same time, there's an enormous effort going into preparations for the time when there is a surge in cases requiring hospitalization. Over the coming month or so, we expect we will see additional community transmission cases being identified. At some point, we will shift resources from case investigations into other areas, such as our surge response. But right now, we see it as a critical piece of what we can do to slow this virus. What we are telling people in our community is that our best practices right now as a whole are to comply with shelter in place, minimize our exposures outside the home, and again, telling individuals to stay home when they're ill until at least 3 days after fever is resolved without fever medicine and symptoms are improving, and it's been at least 7 days since their onset of symptoms. Because we know, although we really are working to increase testing capacity over time, it is important that people understand that right now there's a need to prioritize testing to certain individuals who are at higher risk either by their occupation or their health status or their presence in a congregate care facility such as a hospital, nursing home, jail, that type of thing, as well as opening up testing to people with symptoms consistent of COVID. In the best of all worlds, we would be able to broaden that markedly, and we're working towards that. Thank you.
Thank you so much, Doctor. We're going to be getting your questions over to the doctor momentarily. First, we're going to hear from the County of Trinity and the County of Del Norte. Let's go over to the Trinity County team. You have the Public Health Nursing Director on the line tonight. Thank you so much to Marcy Jo Kutzel, who is dialing in live from Trinity County. We also have Richard Coons, who's the Chief Administrative Officer, the CAO for Trinity County. The Public Health Nursing Director is going to kick us off on an overview of coronavirus and their response in the county. Madam Nursing Director, you have 5 minutes. I'll give you a 30-second prompt. The floor is yours, and we welcome you tonight.
Thank you, Senator McGuire, so much for this opportunity. Here in Trinity County, as you know, we have implemented aggressive non-pharmaceutical strategies designed to prevent the spread for as long as we can, to ensure that we can stand up our response and ensure that our healthcare system, first responders, are able to provide the care to those who need it. As you know, we are a rural frontier community. We have limited resources. We have one critical access hospital, and on a good day we could have challenges around surge. But in this particular event, this is unprecedented. I'm surprised. I didn't think I would see this in my lifetime, but here we are, and we're ready to respond in the best way that we know how in the moment. And so here's what we're doing in Trinity County. First, I'd like to give you a count of the tests that we've done and those outcomes. We have 45 individuals that have been tested, in Trinity County as of 9:30 this morning. 43 of those were negative and 2 are pending. At this time, we have one case that we're monitoring who had a significant exposure to a person diagnosed with the illness. That person will be monitored over 14 days with the symptoms being monitored to ensure that symptoms don't develop. We have been monitoring our population's response to these aggressive orders. We have put a crisis communication strategy in place, which includes online resources as well as biweekly press releases and a weekly press conference in order to provide the public real-time information on the actual threat that we face. We want to be honest, and what we're doing and how they can help us to mitigate and plan appropriately to be able to take care of our populations. Some of the challenges we face are focused at this time around obtaining PPE and testing materials. Our critical access hospital has the ability, because they have the equipment, they have an analyzer that they can actually conduct the tests, and we could have those test results back in 5 minutes. And that's so important because that would allow us to expand our testing. Right now, we're testing only the most ill individuals, but I think as we go along, some of the lessons we've learned in H1N1 and other pandemics is that we want to broaden that testing to be able to capture those people that may have illness that aren't that don't have the symptomology, the symptom picture that we have right now of severe illness. And so we are waiting for our PPE. We anticipate that will come. We're ensuring that our first responders, that includes law enforcement and our essential workers, have access to PPE to ensure that our critical infrastructure continues to function. And we are also leaning into advanced surge planning. This includes engaging our hospitals and our emergency medical systems, as well as our internal public health system, to look at what are the triggers for implementing our surge plan. And it won't be much in Trinity County. Our public health is already engaging in our surge plan, and we're looking at surge in the health department as more than just looking at the surge of COVID. We're preparing for that. We're looking at staffing and how to do that. There were lessons learned in the campfire, and I say this around large numbers of people that need medical services, and we're looking at what that might look like and what those lessons were in that situation that we might be able to utilize around staffing in this particular event, this pandemic, because of the need for resources on a state and national level.
So we're also
cool, great, thank you. So we're also looking at secondary mortality rates. We want to make sure that, for example, pregnant women who are planning on delivering between April and May will have access to care. Things like that are kind of outside the framework of the COVID-19 pandemic in response to the actual illness of those individuals, and looking at all those other individuals and needed care that might go on simultaneously. And that's it for me. Thank you so much.
Thank you so much, Madam Nursing Director. We're grateful that you're on. We'll be coming to questions in just a moment. We're now going to turn it over to the County Administrative Officer, Jay Serena, as well as the Public Health Officer, Dr. Raywalt. The doctor was just on a call with the California Department of Public Health. We're grateful that he was able to make time tonight. We'll start with Mr. Serena, then we're going to go to the Public Health Officer. Mr. Serena, Doctor, you have 5 minutes. The floor is yours. I'll give you a 30-second prompt.
Thank you, Senator, and thank you for your work on the North Coast and particularly Del Mar County. Before I get into a few details, I would like to thank and acknowledge the employees of Del Mar County. They continue to work on the front lines and are doing their best to serve the public in a real trying time. And as you know, they're also disaster service workers, and so they're on call regardless of the situation. Currently in Del Mar County, the number of tests administered are 73. We have 11 tests pending, and 62 of those tests have come back negative. We have been very active, primarily through the Public Health Office and through Dr. Raywalt, in following the local and state orders. Del Mar County has closed campgrounds and associated parks, playgrounds, and other recreational facilities. We've also had a recent order for the closing of short-term rentals. We were essentially an island, and we were seeing visitors come in. All non-essential businesses, as is typical throughout the state, have been ordered to cease operations, and we're following those guidelines pretty much to a T. Del Mar County's own offices, our operational offices, have shut down to the public, and we're accommodating them through appointments and or through telephone calls and the internet, email. We continue to stress to the residents to stay home except for essential businesses, follow the guidelines for social distancing, and when you do go out, continue to use good hygiene. Del Mar County Office of Emergency Services activated at a level 2, and one of the first things that we were able to accomplish was to put together a call center for people that had needs and questions. In addition, through the local public health officer, we're reviewing hotels in preparation of the surge and what might be able to be done to assist emergency housing needs and medical recovery. We're also working with a lot of local volunteers, in particular our CERT volunteers and other partners for food distribution, primarily for our most needy and vulnerable population. We're preparing for possible animal care in the case of the surge to the hospital and what the needs may be for these people who can't take care of their animals. And one of the more interesting and exciting sections that was set up out of our EOC is an economic resiliency group, primarily set up with the lead of the city of Crescent City and some private business owners. The cooperation includes local banking and financial institutions, as well as the Arcata Economic Development Corporation, and it's for primarily dealing with these businesses that are going to have immediate needs because of the shutdown of their business. And hopefully, as we go through that, we can address a lot of their needs and try to soften that impact as much as possible. For the next 30 to 60 days, we're preparing for the worst and hoping for the best. Most of our residents have heeded the social distancing orders. We do have the occasional problem, and our public health officer has been very diligent in addressing those through voluntary compliance. It can be difficult when you have no cases at this point, but I think our community as a whole has embraced this and understands their role and responsibility, and I think that to the greater good, they're going to do their part.
Thank you so much, Mr. Serena. We have about 30 seconds left. We're going to get we have some individual questions that's going to be coming in for the public health officer. Dr. Reynolds, do you have any items that you'd like to be able to add quickly, and we'll be able to also have you do some reporting as the questions are coming in. We have now over 800 folks who have joined us on the telephone town hall. Thank you. Doctor, any last-minute items that you'd like to be able to share before we go to questions?
Yeah, thank you, Senator. I really appreciate the opportunity for the town hall meeting tonight, and I just want to say I think Jay summed up a lot of our efforts pretty well. I know one question that's on a lot of people's minds is what's going to happen with medical care, if the surge starts to hit us in a meaningful way. And I just wanted to tell people we've been working very hard and very closely with Sutter Coast and other medical offices in the community, and even now including Pelican Bay State Prison and their medical staff, trying to coordinate a lot of efforts to keep things going. And I think that's what's going to pay off in the end, is keeping our medical system working at its maximum and as smoothly as possible. And I think the efforts of our citizenry to stay home and shelter in place and slow the virus down like we've been asking them to do for so long, I think it's going to pay off. So we're optimistic, guardedly optimistic, that we've got things in place that are going to help quite a bit.
Doctor, thank you so much. We are now going to be going to questions from all of you who are on the line. Our goal for tonight is to be able to provide the most accurate, timely information from those who are on the front lines combating the virus in Del Norte, in Humboldt and Trinity counties. Let's go straight to the questions and comments. Dr. Raywalt, we're going to stick with you. This first question is coming in from Linda in Hyuchi. What are you doing to prevent the spread of the virus in Pelican Bay? You just mentioned that. Linda just emailed us the question. Can you address that, please?
Yeah, a couple of things. We were kind of dismayed to learn about prisoner transfer still going on. And I didn't quite understand that given the nature of the shelter-in-place order from the governor's office. So the healthcare district, which is, used to run the old hospital when it was a county hospital and still is pretty heavily involved in, medical care issues in the county, they kind of took the lead on this, and they got me to back them up as health officer, and we sent a letter to the governor's office asking them to actually stop transfers. And I don't know if it was our letter or other input from other counties that made the difference, but we've been told that they are actually pretty much shutting down any transfers between institutions, hopefully for the duration of the outbreak. And that's a big plus because, they were taking some good measures to make sure that anyone who was arriving was going to be infection-free. They were putting people in quarantine automatically, basically, as soon as they arrived. But, our concern is not so much just the fact that it could be coming, on a bus with a prisoner. It could also be coming with one of the correctional officers who was transferring with that prisoner and, guarding them during transfer. And we know that so many people can be spreading the virus without realizing it because they're not really feeling that sick or they haven't had any symptoms at all, but they're starting to get sick and they can still transmit the virus. We thought that was a risky kind of operation. So we were really glad to see them shut it down. And one of the prison system directors talked to me last week, and we had a good conversation about it, and I think it was a step in the right direction.
Thank you, Doctor. We're really grateful. To all of our presenters, again, we're so appreciative that you're on. We are literally getting hundreds of questions coming in, so we're going to ask folks to be able to be just rapid fire on these questions. We're going to try to get to as many as possible. This next question is coming in from Suzanne in McKinleyville. This one is going to be going to Dr. Frankovich. Dr. Frankovich, this is Suzanne. When will we have enough coronavirus tests to cover all of us to ensure we're not an asymptomatic carrier?
Well, I would say that our local public health lab is certainly too small to be able to test our entire population in terms of asymptomatic individuals. And actually, my desire would be that we had sufficient testing at this time to be able to test, mildly ill individuals so that we can identify those folks as well. I think for us to be able to do mass testing on the scale that the caller is referring to, we would need resources from outside the area to do so. So we have been in conversations with the state about that, but I don't have anything concrete at this time.
No, appreciate that. Where we've been seeing a lot of the testing be prioritized are in states that are having significant breakouts like New York. We continue to ramp up in California, but obviously this has been a challenge from the very beginning, which means we're going to go to Dr. Reingold for our next question. This one is coming in from Catherine from Fortuna. Why is the United States so far behind in testing? Dr. Reingold, quick answer, please.
Well, I think we have a very tight regulatory system and an old-fashioned way of doing things that is not amenable to speeding up the process the way a lot of countries were able to do. So we're playing catch-up at this point, to be perfectly honest. We have the technology. We have wonderful laboratories and wonderful scientists. So it's really a question of not having decided to bypass some of the regulatory issues or to expedite them.
Thank you, Doctor. We're going back to Dr. Frankovich for Humboldt County. She's the public health officer. We have a lot of questions in regards to the Humboldt County Airport. This one is coming in from Elliot. Says that we all know that air travel is one of the top ways, number one ways the coronavirus is spreading. Why on earth haven't the county restricted air travel? I'll have a conversation about that in just a moment about where the feds are looking at. But Dr. Frankovich, Humboldt County Airport, keeping it open or closing it down?
So basically at this point, I agree with the caller in the sense that travel is a big risk area. We have done what is within our power to do here in terms of posting signage, informing individuals returning about 14-day quarantines, explaining to the public that non-essential travel should be canceled and only essential travel should not. It's important for people to remember that the airports do provide capacity to bring in resources such as healthcare workers and other essential service workers in our area. And so shutting it down completely is problematic for an area where, for instance, we rely on locum tenens physicians to assist. That being said, the warnings are important. And also, of course, I want to note that counties at this level do not have the authority to shut down air travel.
Thank you, Doctor. And piggybacking on that, the federal government is starting to review domestic air travel. It's still being reviewed by the FAA, disease control. We may see some enhanced restrictions on domestic air travel here in the coming days to a week. President Trump addressed that today. No answers yet, but that is currently being reviewed by the federal government. This next question is going to be for Dr. Renault in Del Norte County. That's coming in from Joseph. Can I still go for daily walks around Crescent City? Dr. Renault?
Yes, you can. I think there's been some confusion about the extreme interpretation of stay at home. We want people to still get exercise. We want people to get outside. As long as you're doing something like that and you're not congregating with a bunch of friends and meeting up somewhere and just hanging out and and not observing social distance, it's perfectly fine. We would prefer that people get some activity during all this.
Thank you. This next question is going to go to Dr. Frankovich from Humboldt County. We're going to ask folks to be able to mute if you're not speaking, if you don't mind. Thank you so much. Dr. Frankovich, similar conversation coming in from Humboldt County about being able to walk around their communities. Are you still able to walk around the neighborhood with the shelter-at-home order in Humboldt, Dr. Frankovich?
Yes, we've tried to be really clear about this. We think it's important for people to be able to get outside, I think for mental health purposes and obviously for overall health. So it's a stressful time right now. People are free to go out. They should only be in a group if it is their family unit, their household unit. They are not to congregate with other individuals in a way they might have before, for instance, in team sports or jogging groups, that type of thing. But people are absolutely free to enjoy our outdoor, for instance, hiking trails and things. Areas that we cannot guarantee that there is not congregate activity, some of those areas are closed off, such as playgrounds and that type of thing. But we really do want people to get outside. We just want them to be really conscious about the social distancing and not gathering.
Thank you so much. This is going to be now for Dr. Reingold. Dr. Reingold, how long can an individual be asymptomatic and carry the virus? This is coming in from Gloria from Trinity County.
So we think that for people who do eventually develop symptoms, they can be asymptomatically infected for at least, and shedding the virus for at least a couple of days before they develop symptoms. But in terms of people who never develop symptoms, if that's the question, how long can they remain infected after they acquire the infection? The honest answer is we don't know. If I were going to make an educated guess, I would say it probably wouldn't be in excess of a week or two, but we really don't have that information yet.
Thank you so much. Just 30 seconds or less, Doctor, what precautions should an individual take if they believe, even if they don't have symptoms, that they may be exposed to the virus? What should an individual do in regards to isolation?
Well, we want them to basically self-isolate and be in contact with their healthcare provider to seek advice from that individual. If they do need to be in contact with others, it would be good for them to wear a mask and exercise good hand washing.
How long should someone self-isolate if they believe they're exposed?
Well, in theory, again, this is all sort of being made up, to be perfectly honest, but it certainly shouldn't have to exceed 14 days, but I would consult with your healthcare provider in the individual instance or with the public health agency.
Thank you so much. This next question is going to Dr. Frankovich in Humboldt County. This is coming in from John in Eureka. My wife and I want to go to Arizona in our RV, take a couple of days off, self-quarantine, so no need for lodging or restaurants. Our home there has no occupants, so there is no chance of spreading the virus. We have no symptoms. Is it against the intent of a shelter-in-place order to travel out of state or out of county? Dr. Frankovich?
The simple answer is yes. We are recommending the reason shelter-in-place is that everyone really should remain where they are. Moving across between other areas of the state or other areas of the country, it's impossible to do that with encountering different communities, all different businesses, even if you're living in your own trailer or RV. And so it's really important that people stay put as we try to address this.
Thank you. Dr. Frankovich, we're going to stick with you. This next question is coming in from L'Oreal. What is Humboldt County doing to bring more hospital beds and ventilators online to St. Joe's?
So we are obviously, we've been assessing our bed capacity, both for regular beds, ICU beds, and ventilators. We have looked at what the hospitals have baseline and how much they can increase that capacity inside their walls as they exist. We are then looking to exceed that capacity by addressing alternate care sites where we might put less acute patients that don't need intensive services so that we can decrease the burden within hospital walls. We are organizing our disaster service volunteer lists to be able to bring in additional people to help manage patient care. And we are reaching out basically to our state resources as well to say what we believe we're going to need.
Thank you so much. This is going to go to Marcy Jo Kutzel, the Public Health Nursing Director in Trinity County. This is coming in from Elizabeth. My question is whether and when we can expect testing to be available in our area. We live in Trinity County where there are no reported cases yet, but there is a nagging suspicion that this is only because a lack of testing is available in the community. Would you mind addressing that, Marcy Jo?
No, not a bit. Thank you, Elizabeth, very much for that question. We are operating under the assumption in public health that COVID may very well be here because of that very issue you brought up. That doesn't mean that we can't really monitor and manage without knowing exactly who has it and how many. Because of the non-pharmaceutical strategies such as quarantining and isolation and social distancing and washing your hands and not touching your face, to buy us time so that when the testing catches up, because we really don't have any control right now, as Dr. Reingold stated, over the testing supplies availability. We're looking at doing that. We're ready to implement it. We've got strategies in place when those testing materials become available. And in the meantime, we're reiterating with our public the importance of the social distancing and the isolation and quarantining orders that have been put in place and the prevention strategies that we've put into place.
Thank you so much. This next question is going to Dr. Raywald in Del Norte County. This is coming in from Paul. Doctor, how many empty and available beds does Sutter Coast Hospital have? How many empty and available ICU beds does Sutter Coast Hospital have? Dr. Raywald.
Well, in general, they have about 49 beds total capacity, and their ICU capacity can fluctuate a little bit. There's a couple of beds that can be converted to full monitoring. In general, they only have about 6. In a surge situation, they can probably ramp that up to over 20 without too much difficulty, because they would use some space in recovery areas from surgery in the hospital and use those as a kind of a general ICU ward. And again, the limiting factor, as everybody else talks about, is how many ventilators you have. They have some portable ventilators to add on to their usual stock. They have some operative ventilators. There's a chance that we're going to get some refurbished ventilators pretty soon. They're telling me they think they'll have probably in the neighborhood of 20. They're not entirely sure yet. So that's pretty good positioning for a small hospital. And they have some other ideas for extra space for non-critical care beds as well.
Thank you so much, Doctor. We're now going to go to Dr. Reingold from UC Berkeley School of Public Health. This next question is coming in from Cypress and Arcata. She has a question about what Dr. Fauci has said, that children can have the virus with little to no symptoms. Can you explain that? And how does a parent know if his or her child is infected with the coronavirus?
Well, the answer to the second question is the parent probably will not know. That's the honest answer. Why it is that children tend to be mildly affected or not affected at all, we don't really know the answer to that. It may be because of circulation of other coronaviruses that either interfere with this one's ability to infect or possibly give immunity that cross-protects. But the honest answer is, while the observation is correct, we really don't have a good explanation yet.
Thank you so much. Dr. Reingold, we're going to stick with you. This next question is coming from Frank and Susan in Willow Creek. When a person passes away, how long is that individual who has passed still contagious?
Well, I don't think we know the answer to that. I think the concern in that situation has certainly been a problem in Ebola virus infections in West Africa, where the body is heavily infectious and people caring for the body have become infected. but I don't have a concern that we'll have transmission from people who have died to the people who are involved in preparing the body for burial. I think they can pretty easily protect themselves through gloving and masks and other things.
Thank you, Doctor. This question is coming in from Susan. I have a question about the stimulus checks. Are the checks going to be paid out to seniors on Social Security who don't receive enough to file taxes? The long and the short of it is this question, the answer is evolving. Long story short, if you're on Social Security and you do not pay taxes, you are going to have to fill out a form by the IRS to be able to get your stimulus check, that $1,200. The IRS is still working on the development of that form. So if you file taxes, you will automatically get that check. If you don't file taxes and you're on Social Security and you fall under that threshold, you will need to fill out a form, and candidly, that form is still being developed. But if you are on Social Security and a senior and you don't file taxes, you'll still get that check. We're going to stick with Crescent City. How do high folks, so this is coming in now to Dr. Raywalt, how do high-risk folks, 65 plus, and those with underlying conditions know when to call their personal doc or know when to head for an urgent care or ER?
That's a really tough question. It's a good question. We think that the bar needs to be a little bit lower in general for people who are high risk because we know in general they don't do as well or they are more likely to have a problem with recovering. So I would say that if you're becoming ill to the point where you're feeling very depleted, very short of breath, or even mildly short of breath, you should certainly be talking to your healthcare provider. The fever is another issue. If you're having a very high fever and it feels like a very severe flu, that might be enough to trigger the call and ask them what they want you to do. I think people need to be pretty mindful that they can deteriorate a little bit faster if they have those kinds of conditions and a little bit tougher course in the hospital.
Thank you so much. We're going to stick right now with the good doctor from Del Norte County, who is our public health officer in Del Norte, Dr. Raywalt, and then we're going to turn it over also to Dr. Frankovich. This question is in regards to tribal nations. How are you assuring that local tribes, for example, UROC, are getting the support they need as far as the coronavirus prevention and response are concerned? Dr. Raywalt, first from Del Norte, then we'll go to Dr. Frankovich from Humboldt. Doctor, talk about the outreach to tribes, and then we'll go to Dr. Frankovich in Humboldt County.
Well, we've been working with representatives from the tribes since the beginning of this, and I think the message for all the members of the county, tribal and non-tribal, is pretty much the same. And I think the service that we're going to provide is going to be pretty much the same. I think the unique features of the Yurok tribe is because of their location a little bit farther away from Crescent City. And we understand that, and we're well aware of that. But that's true even under normal circumstances. So, we've tried to be inclusive as much as we can, and the message that we've been putting out is for everybody.
Thank you so much. Dr. Frankovich, outreach to tribes in Humboldt.
Sure. So one thing we're doing we're doing currently governmental calls, including tribal entities twice weekly, so that people can ask questions about both impact locally as well as accessing resources. We also have been asked to participate in assisting in some response plans with tribes. So we've been assisting with those in addition. And I think those are two of the principal ways that we've been working with local entities.
Thank you so much, Doctor. We're going to go back to Del Norte County with the public health officer. This is coming in from Mike in Crescent City. The question is, I'm a store manager of a major retailer in Crescent City, and the pandemic is truly affecting our town just like anywhere else. My question is, how long will the mandatory stay-at-home rule be in effect? Let's go to the public health officer in Del Norte County.
I would answer that in a very simple way. At some level, the the local health officers are kind of agents of the state in an event like this, a worldwide pandemic. We have to kind of be the lowest rung on the ladder in the terms of the state plan. So I guess my answer would be very simple. We really need to follow the developments at the statewide level and the decisions by the governor's office, because as long as the governor has this order in effect, we have to implement it. That's the way I view my position at the county level in a statewide organization.
Thank you. So again, where Del Norte County is at is, as long as we see a stay-at-home order from the state of California, Del Norte County will be essentially lockstep, if you will, with that statewide stay-at-home order.
Yes.
All right. Thank you so much, Doctor. We're now going to go back to Dr. Reingold from UC Berkeley School of Public Health. Dr. Reingold, we're getting a lot of questions tonight. I'm looking to Carrie Lindecker here, who is with me. How many? About 14 questions on money and on food. Should we be disinfecting money? Should we be disinfecting food that we get at the grocery store? Dr. Reingold.
So first of all, there have been some preliminary studies of how long this virus might persist on various surfaces. I think with regard to money, the evidence is that the virus doesn't persist very long on paper. But I shop in some stores where they'll only take credit cards because they don't want to handle bills. So I guess some people are concerned about that. I'm not personally. With regard to fruits and vegetables and other food products, we really don't have any information about survival on or transmission by fruits and vegetables. But if you would feel an added sense of security, you could certainly wipe down your vegetables or fruit, the ones that are amenable to that. But I also think good hand washing is fundamental to trying to protect yourself after you've been shopping.
So this is a related question, Dr. Reingold. This is coming in from Nancy, who lives in Klamath. She is still confused about how to treat metals and plastic that food comes in. Should she be worried about the metals and the plastic that food comes in?
Well, again, there are now at least one or two studies that show the virus can persist on stainless steel and on plastic. So wiping those down with a disinfectant certainly could be helpful. But again, hand washing after you handle such packages is probably your single best protection.
Thank you so much, Doctor. We're now going to go back to Humboldt County. Dr. Frankovich, this question has to do with homelessness. And what I'll say is that the state of California is moving literally hundreds of thousands of dollars into each of Del Norte, Humboldt, and Trinity counties to help counties deal with homelessness. We know our homeless population is at one of the most at risk to the virus, as well as spreading the virus. So about $635,000 has been moved into Humboldt County to help Humboldt combat the virus with the homeless population. Johnny is asking, how is Humboldt County planning to work with the issue of people experiencing homelessness and coronavirus due to the shelter-in-place order? We're going to turn it over to Dr. Frankovich, who is the public health officer for Humboldt County.
Hi. So it is an enormous problem, and we have been working DHHS and with public health, along with coalitions and agencies that serve homeless, have been working together to address the issue. One of the most immediate needs we saw was the need to have somewhere for people who are homeless to go when they are suspect or confirmed cases. So we have been establishing that so that we can help to shelter and provide food so that people can be cared for in that period. And that's a huge priority to get people who we feel are potentially infectious out of circulation amongst peers and the community. We're also working on implementing some screening, health screening basically in settings in which homeless receive services, and then have a triage setup scheme sort of to help them get tested if needed, and then again to sort of help them in that interval period until their testing is completed, or if testing is confirmed. And I think the larger issues around, as the governor said, trying to get people in general off the street, again, is a much bigger task. And all I can say at this time is that we're really working to address that piece of this as well.
Thank you so much, Doctor. We have a few minutes left. We have time for just a few more questions. If you'd like to get your last-minute questions in, your comments, senator.mcguire@senate.ca.gov. We have a few minutes left, and we're grateful that all of you have been hanging with us here this evening. We are so appreciative for all the doctors, our nursing director, our county administrators who are on the lines for their incredible work. Really, local leadership has stood up over the past 2.5 weeks with this virus and have been doing some amazing work on behalf of our communities, and we want to say thank you. This next question is coming in from Ron in Del Norte County. Can I get the 13 weeks of unemployment benefits? Because I cannot look for a job because businesses are shut down. Del Norte County has closed the county hotels, and Airbnb is now cutting what little income we had. And this individual had applied for unemployment, but his 26 weeks ran out on March 17th. So here's the new rule when it comes to unemployment. If you qualified for unemployment on January 27th of 2020, you are still eligible for the 4 months of federal unemployment benefits. So right now, here's how unemployment works. You should go out and apply to the Employment Development Department. Right now, you can get up to 6 months from the state, a maximum of $450 per week. It's not much to live on. The federal government is going to supplement the first 4 months of that 6 with an additional maximum $600 per week. So if you were eligible for unemployment on January 27th of this year, you should apply to the California Employment Development Department, and you would get 4 months of the federal share of unemployment. So make sure you are applying. Here's where to do that. If you are unemployed, and over 1 million Californians have now applied for unemployment in the last 15 days, please go to edd.ca.gov, edd.ca.gov, to be able to apply for unemployment benefits. At this current time, it takes about a 3-week turnaround time from the time you submit your application to the time your first check will arrive. We're now going to go. We have a few last questions. Dr. Reingold, we've gotten a few questions from folks about their pets, worried that they're going to be able to get coronavirus from their pets. Dr. Reingold, can you address that?
We have absolutely no evidence that that's happening or is likely to happen. So, I think that's an incredibly low risk, if any risk at all.
Thank you so much. Very grateful, Dr. Reingold. We're now going to go back to Dr. Frankovich. Dr. Frankovich, what is being done to develop antibody tests in order to find out how many people have been exposed to or recovered from coronavirus?
Well, it's an excellent question. I would love to have that information, and my understanding from a recent discussion is that we don't have at this time available an FDA licensed test to do that. Dr. Reingold may have some updated information on that, but certainly it's technology we would love to see as we go forward. Right now, of course, our emphasis is on getting testing for original diagnosis.
Thank you so much. Very grateful. We're going to stick with Dr. Frankovich. This one's coming in from Daniel. Are we able to find out what cities here in Humboldt have had confirmed coronavirus cases?
Well, the residents should be aware today we put out information where we were at least trying to give people a sense of where the bulk of our cases are. I do not see us talking about individual cases in their individual towns. And the reasons we've talked about are a fewfold. One is that we have concerns about personal identifiers. Obviously, in very small areas, a single case can often be quite obvious to everyone. The second is that we have concerns about people making assumptions and planning their activities based on thinking if there's no one in my town, then I am free to move about and not be concerned about infection, which is not true. Everyone is at risk. And the third is because there have been instances of people, being somewhat threatening and about individuals they think have infection in other areas of the country and even locally. And I think we need to be sure that people feel safe to be tested and identified so that we can make sure we identify everybody who has infection, that we can give instructions to isolate and quarantine.
Thank you so much, Doctor. We have time for just a few more. We're grateful that all of you have stuck with us. We're going to go to Trinity County. We have two questions for Trinity County. First and foremost, Richard from Weaverville is asking Trinity County, why are hotels still open in Trinity County? That could be for our nursing director or our county administrator.
Yeah, I'll hand that off to Richard Kuntz, our CAO.
Hotels are open primarily for, we're using some of our hotels for shelter in place for our homeless. We're also using them. We have a large population of people who come through who work in Trinity County. We're building a jail right now, so they're using primarily for people who are working in Trinity County and don't have other places to stay. So we have put a quarantine on anybody who owns second homes in Trinity County, but if they come from the the urban areas and to their second home, that we ask them to quarantine in place for 14 days. But the hotels are primarily being used for those that do not have a shelter, and we can monitor them, or those that are working in the community.
Thank you so much, Mr. CAO. Second to last question, this is going to go to Dr. Reingold, and obviously we'll be happy to have the County Administrative Officer chime in on this as well. Dr. Reingold, this is coming in from a county supervisor in Trinity County, Supervisor Brown. There's been a lot of questions from residents who've been asking Supervisor Brown, why is the coronavirus so different than the flu? And why has it turned into a pandemic requiring such extreme social changes?
So it is a very different virus, although it produces a similar clinical picture in terms of fever and respiratory symptoms. But the virus itself is very different. And I think the two most important differences that are important are that, first of all, no one in the human population has immunity to this virus, while most of us have some level of immunity to influenza acquired over the years. And secondly, this virus is more readily transmissible from one person to another than the influenza virus.
Thank you so much. Mr. County Administrator, any items that you'd like to be able to respond to Supervisor Brown on?
No, not at this time.
Okay. And the final question for Dr. Reingold, I know you addressed this in the beginning about masks, but Dr. Reingold, we are getting inundated with questions about masks. Just plain and simple, shouldn't we all wear masks? That's been the gist of many of the questions that are coming in tonight. Can you set it straight one last time on the issue of masks? Do they really help?
Well, this has been evolving, and certainly in the past we said they were primarily most important in the context of healthcare providers, and if a sick individual who is coughing and sneezing had to be near other people, that he or she should wear a mask. But I think increasingly the evidence is that it might be add some protection to people to protect themselves by wearing a mask. A surgical mask in most cases would be fine, but we don't want that to deplete the supply of masks available to frontline public health workers. But if you're going to be around other people out in public, wearing a mask certainly won't hurt you and could potentially provide some benefit.
Thank you so much. We are going to have to be able to conclude tonight. Want to say thank you so much to all of our panelists. Dr. Reingold, 20 seconds. Any final words for those who are listening in tonight?
Well, I think for young people, this will be something you tell your grandchildren about. This is definitely a life-changing event, and we all need to get through it.
Thank you so much. Dr. Raywald from Del Norte County, the Public Health Officer. Final comment on coronavirus and response in Del Norte.
I think everybody needs to keep staying home and cover their coughs and sneezes, wash their hands, just keep doing what you're doing, and we'll get through this.
Thank you so much, sir. Marcy Jo Kutzel, Public Health Nursing Director from Trinity County. Final comment, please.
Thank you so much for this opportunity, and I just want to say to all our residents and our population, thank you so much for helping us to contain this, and we're actually saving lives when we do that.
Thank you, ma'am. Dr. Frankovich, final comment.
Echoing that, I really can't say how deeply I appreciate the sacrifices people are making to help their friends and neighbors and the community as a whole. The only way we will succeed is doing this together. So I consider it a large, very large public health team.
Thank you so much, Dr. Frankovich. And again, I want to take a moment to say thank you for all the doctors, all the public servants who are on the line tonight for your incredible work. I also want to say thank you to all of you who are listening in. I'm going to be honest about this. We have some challenging days ahead. But I know as a state and as a region here on the North Coast, we are going to rise to this moment. And as we talked about in the beginning, hard work is what we're all about here on the North Coast. And I want to say thank you for pitching in to be able to help your neighbors in need. And speaking of that, California desperately needs help with medical professionals. I hate to ask you, but if you are a medical professional who has been retired, or if you're a medical student, we need your help to be able to join the fight against the coronavirus. We need 40,000 nurses and doctors and licensed vocational nurses to be able to help fight this virus. You will be paid. You will be able to get insurance. We need your assistance to be able to join the California Health Corps. If you don't mind, please go to covid19.ca.gov to be able to sign up to be able to help serve this state and help your neighbors in need. Finally, an audio file will be available of this town hall coming up tomorrow evening. We'll be posting that online. Thank you all for tuning in. Thank you for this opportunity to work together. Stay healthy. Stay safe. We're going to get through this together. Have a good night. Thank you so much. This town hall is now concluded.